Working as an occupational health nurse during the COVID-19 pandemic has been a challenge that required unique leadership and adaptability by OHNs in the workplace. In an effort to understand the occupational health nurses' experiences since the onset of the pandemic, I developed a 45-item survey in collaboration with leaders from the American Board for Occupational Health Nurses. In September 2021, the online survey was sent to over 5,500 occupational health nurses in the United States and Canada, with 565 OHNs completing the survey. The survey responses showed many interesting findings about how the occupational health nurses have endured and adapted during the pandemic. OHNs traditionally have performed work that revolves around work-related injury and illness assessment, medical surveillance, disability management, ergonomic assessments, and immunization, education, and administration. With the onset of the pandemic, they had to alter their focus of their work, emphasizing work on tasks like educating employees on the importance of infection control practices, implementing new policies for social distancing and wearing masks, illness assessment, treatment, and triage, contact tracing, and return to work policies. OHNs needed to attend more meetings with management, with safety teams, and with outside agencies like the Department of Health to adapt new policies and practices, learn the latest data on case rates and trends of the virus, and educate the employees. The survey showed that OHNs frequently felt overwhelmed by the employees' questions and concerns regarding the COVID-19 pandemic. OHNs were asked to work longer hours, with some being on call 24/7 to field employees' questions and concerns. Unfortunately, an increase in workplace threats of violence was felt by 16% of OHNs during the pandemic. There was a trend found between the size of the company and the percent of OHNs that experienced threats of violence. As the size of the company increased, so did the percent of OHNs who stated they experienced threats of violence in the workplace. All these factors added to the OHN's workload and stress. At the end of the survey, OHNs were asked what is one thing they would like to change now that they have worked during the COVID-19 pandemic. Many OHNs expressed a need for additional help, more access to resources, more ability to guide new policies for their workplace, and to review pandemic planning annually to be better prepared for a pandemic in the future. Insights gained from this survey should contribute to improving the safety and workflow for OHNs on a national and possibly global level. I hope that by sharing the survey results, we can help support occupational health nurses and bring attention to how OHNs support employees, workplaces, and successfully adapt to provide new safe practices in their workplaces. Thank you.